Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, I'm going to go over one essential exercise when it comes to your recovery and rehab after knee replacement surgery. So before I hop into it, be sure to hit that subscribe button and turn on the notifications so you can catch all our videos related to knee replacement surgery, exercises, recovery and rehab, frequently asked questions, preparation, and details of the surgery itself. So the one essential exercise I like to say is a combination of probably, you can call it multiple exercises or multiple progressions of the same movement or the same exercise. Now of course there's all these different exercises for bending and straightening the knee, and all those are very important and very beneficial and you should absolutely do them. But one thing that is sometimes overlooked is the functional exercises and the movements that are functional and strengthening and based on movements and activities that you would do in your normal day-to-day life. And so with that, one of my most essential exercises is the sit to stand. Now the sit to stand is essentially a way to perform the movements of a squat. So you're really using very similar muscle groups. You're using the quadriceps of your thigh, you're using your glutes, all these muscles to push your body up against gravity and to slowly lower your body back down, moving with gravity, just like you would with a squat. And of course, sit to stand is something, how many times do you get up and down from a chair throughout your day? Besides walking, it's probably one of the most functional exercises or movements that you could probably do. So I'm going to go over quick how I like to instruct people to do sit to stand to really get the most benefit from it. Sometimes I'll tell people to do sit to stand and they'll just do, they'll just rush through it really quick, pushing up with their hands, using their momentum, not really getting the strength benefits that we want from doing the exercise. So first thing is you want to scoot forward in your chair enough that your thighs are off the edge of the chair. If you're back here, too far in the chair, you're not going to have as much of a leverage to help push yourself up. So you can possibly do it, but it might be more difficult. So you want to scoot up, so probably about half of your thigh or even more are off the edge of the chair. Sometimes I encourage people to really just kind of sit right up on the edge of the seat. You're going to have your feet on the ground. I like to bring them back a little bit so they're kind of a little bit behind the knees. If their heels are up, that's okay, but not necessary. If you have them on flat, that's usually what I prefer, is have the feet flat on the floor. Now the important thing with the sit to stand is we want to keep a relatively neutral position of your trunk and your back. We don't necessarily want to crouch up like this to stand. Instead, we want to use that hip hinge movement, keeping the back in a relatively neutral position as we stand up. Now, early on, if you need to use your hands or the armrests for some assistance to push up, that's perfectly okay. But I want to get to a point where you can put your arms across your chest or put your hands on your hips, and then you can stand up without using your hands for support. So all you're going to do is do that hip hinge, and as you go into the hip hinge, you're going to push through your feet and try to basically explode yourself up into extension. Now sometimes people will get to like this position, especially if they have some stiffness and range of motion in their knee that they're still working on. But I encourage people to really straighten up completely tall, like a good, like you're a soldier. You got knees straight, hips straight, everything up nice and tall. And then when you get to this position, go ahead and come back down. Now, important, you don't want to plop down into the chair. You want to use this part of that movement as some strengthening as well. So we want to do it slow and controlled, basically just reversing what we just did. So that hip hinge, pushing up as tall as you can, slowly coming back down in reverse. And that's a sit to stand. Now from there we can easily progress it and make it more difficult and continue to build some more strength. So the next progression I usually like to do, once they're able to do sit to stand, maybe 10 repetitions, aren't using their arms for support, either on their legs or on the chair or armrest, then I want to have what we call sit to stand taps. So you do the stand. Now when you come down, you're not going to sit all the way into the chair. You're just going to tap your bottom and then come back up. Tap and then come back up. What that does is kind of bring in the use of the eccentric control, or the lowering portion of the movement, where you have to control it, and that's going to activate a lot of these muscles to control the downward portion of the movement, just like you would with doing a squat. From there, usually, I like to go to body weight squats. So you can see how this is going to progressively get build up to where you're doing squats with weights even. Now, I like to start people who may not have much experience doing squatting with something to hold on to. This chair wouldn't be good because it's going to fly back on you, but what I usually recommend is at your kitchen sink is a firm surface, and what that firm surface does that's not going to move and you can hold on to it. People may also use, for example, TRX cables are a great option as well if you have those available. And that allows you to kind of hold on in the front, and you can kind of really sit back into the squat movement and then come back up. Sit back into it and then come back up. Lets you get a little bit more range of motion, a little bit deeper into the squat usually. Again, this chair wouldn't be a good option because it moves, but having something sturdy such as your sink, kitchen sink, something like that, it's not going to move, to help you sit back and do the body weight squat from there. Of course, then you can also progress to doing a body weight squat without holding on to anything. And then you can start to add weight. And the easiest way I found to add weight for someone who might not have much experience with weight training or squats is just doing a goblet squat. So if you have a dumbbell or a kettlebell, just holding it in front of you at your chest like this, again, and then just sitting into the squat, trying to go to that parallel position as far as you feel comfortable, up and down. So again, a really essential, really great exercise is sit to stands. Of course, I kind of cheated because it really progresses into squatting and variations of performing the squat-like movement. But if I had to pick an essential exercise after knee replacement surgery, starting with the sit to stand would probably be my first option. Thank you very much for watching. I hope you found this video useful. Please be sure to leave your comments and questions below and hit that like so this video can be spread to other individuals who may benefit from watching it. Thank you very much for watching.